Hi colleagues, today we are going to talk about the different types of cough and its management. So let us begin. So what is a cough? So let us understand. Cough is the forceful expulsion of air from lungs to clear the respiratory passage. And what is that respiratory passage? That is lungs, bronchus and trachea. So this is very simple definition. Cough is the forceful expulsion of air from lungs to clear the respiratory passage, that is lungs, bronchus and trachea. Now types of cough. So there are two different types of cough. One is a productive cough and second is a dry cough. What does mean by it? So productive cough has a mucus. So mucus is secreted, which is also called as phlegm. And in dry cough, there is no mucus secretion, but there will be forceful expulsion of the air. So that is why it is called as dry cough. Now let us understand the pathophysiology behind the productive cough, or which are the problems occurs during the productive cough. So the number one problem which comes, you can see there is a buildup of mucus. So there is a buildup of mucus or production of mucus, number one. Number two, there is a bronchoconstriction or there is a constriction of the windpipe. And number three, there is a difficulty to throw out the mucus which is secreted. So these are three difficulties are there. Now let us understand the management of productive cough. So to manage the productive cough, we require three medications. Which are those? Number one, we require someone who is going to cut the mucus or break the mucus. So for that purpose, we require mucolytic agent or mucolytic drugs. Number two, we require the medication which can dilate the bronchus. So the breathing will be easy, and if the mucus is cut down or mucus viscosity is increased, that mucus can come out. For that purpose also bronchodilation is required. Now third thing which has been remained, that is nothing but we require someone who is going to expel the mucus out, and that medication is called as expectorant. Now let us understand which are the medications available in mucolytic, bronchodilator and as an expectorant. So ambroxol, bromhexine, these are the two important medication which are used into the mucolytic agent. Now how to remember that? If we put two swords in crossway, the alphabet will become X, and X is also called as X. X will be used to cut the wood. So X. So wherever X will come, that means that is a mucolytic agent. So ambroxol, bromhexine, all these are the mucolytic agent. Those are going to cut the mucus. Number two, or break down the mucus. Bronchodilator. So we require bronchodilator, terbutaline, salbutamol, leosalbutamol. These are the bronchodilator. Now terbutaline as well as salbutamol causes tremor or shivering in many patients. So the safest option which is considered, that is leosalbutamol. So leosalbutamol is considered as the safest option compared to the terbutaline as well as salbutamol. But these two drugs also have their significance in certain kinds of cough. Third medication which we require, that is expectorant. So expectorant is guaifenesin. In guaifenesin there are two E. So E stand for expectorant, E stand for expel out, E stand for email, so E stand for exit. So whenever you want to, whenever there is a E, that means you are sending it away. So guaifenesin is the expectorant. Now I hope that you can understand or you can remember this with this analogy. So we covered productive cough management. Now let us see the dry cough management. So what is the dry cough? we have already seen it is a cough without mucus or phlegm. Now let us understand the pathophysiology or problems what happened exactly into the dry cough. So in the dry cough, it is usually start with the allergy or allergen. So when the allergy enter into the nose or nasal surface, it is going to sensitize the cough center present into the brain. So cough center get activated and cough center going to send the signal to the diaphragm as well as lungs, bronchi, and the person start coughing. So this is the simple mechanism. Allergy send the signal to the cough center get activated, and cough center after activation send the signal to the diaphragm as well as lungs, and the person start coughing. So in dry cough there is no mucus secretion. So the management of dry cough requires the different medication. So how the dry cough management is done? Let us see. So number one, we require anti-allergic for the allergy purpose. So any allergen or allergy molecule can be blocked. So the signal to the brain can be stopped. Number two, we require the activated cough center to be switched off. So we require switch off the cough center present into the brain, and for that purpose we require antitussive or antitussive. So to switch off the activated cough center, and after switch off the activated cough center, there will be no signal to the diaphragm as well as lungs or bronchi or trachea. So the person will stop coughing. So this is the simple mechanism. Now let us understand which are the molecules generally used to manage the dry cough. So to manage the dry cough, as an anti-allergy, there is a chlorpheniramine maleate, also called as CPM. Another molecule is a triprolidine, which is also used as an anti-allergic or antihistaminic. Number two, we require antitussive or cough suppressant. The molecule is a dextromethorphan, which is widely used. Second is a codeine phosphate or codeine sulfate. In certain indication, it is used. In some patient, there is a nasal decongestion also happen, nasal decongestion. So we require nasal decongestant also, and that is nothing but the phenylephrine. So phenylephrine is a nasal decongestant. So in dry cough management, we require anti-allergic chlorpheniramine maleate or triprolidine. We require antitussive or cough suppressant, dextromethorphan or codeine, and some cases we require nasal decongestant, that is phenylephrine. I hope that you understand the different types of cough and its management in simple way. Thank you for watching Pharma Biology.
Thank you for watching Pharma Biology, your companion in the pharma journey. Complex topics, simply explained.